Hi, welcome to Solutions for Seniors. I'm Linda Pellerin, the Executive Director of the Shepherd Center of Charlotte. We are a nonprofit organization that uses senior volunteers to help other seniors. And today our guest is Jeannie Skepsey with the Seniors Health Insurance Information Program. And I always like to throw in Medicare counseling because the title of the SHIP program doesn't really say that, but SHIP has been around for quite a while, hasn't it?
We have, Linda. In fact, we'll be celebrating our 25th anniversary in September of this year, and we were created in 1986 by the Insurance Commissioner, Jim Long, at that time, and our purpose was to assist persons who are on or going on Medicare with their health insurance related problems, questions, and concerns. So 25 big years in September of this year.
And I bet 25 years ago, the issues were not as complex as they are now.
It's really changed. When I talk to people, I say it's really evolved. I've been here for 15 of those 25 years, and I remember when I started back in 1996, the things that we were doing and the things that seemed complex at that time. We didn't know anything at that time, and now we have got Medicare Part D and different issues, so it really has evolved, and our volunteers have become a little bit more seasoned because of the changes and because of the intricacies of the program. So it really has changed over the past 25 years.
Yeah, tell us how the program works.
Okay. Well, basically, SHIP, which stands for the Seniors Health Insurance Information Program, is a division of the North Carolina Department of Insurance. So we are a state agency, and we were created in 1986 to help people on or going on Medicare with their health insurance problems, questions, and concerns. And when I tell people about our program, I break the name down, and the first word is seniors. But that's a little misleading because when I poll people in a room full of people and ask them what is the age of a senior, I get lots of different answers. So we tell people we assist any person on Medicare that's 65 and older, whether that's a senior or not in their minds. And then we also help people on Medicare who are under 65 but are receiving it because of a disability. So the seniors is very misleading. We help only with health insurance related problems, questions, and concerns. We don't help with automobile insurance or life insurance or homeowners insurance. We specifically deal with health insurance, and you know as well as I, we have our hands full keeping up with health insurance issues. The second I is probably the most important letter in our name, Linda, because we remind people that we're not here to sell or endorse any plan or company, which is not a bad thing, but it's just not what we do at SHIP. We find out what a person needs and what they can afford, and we sort of spread everything out on the table and help them with their decision making so that when they do decide between a supplement or an advantage plan or what Medicare drug plan that they want, they feel comfortable with and confident in that decision making because we provided them with objective, unbiased information and assistance. And then the last letter P stands for program. As I said, we've been around for 25 years, so we're solid and secure. We're a state agency, and in 1992, 6 years after we've been doing what we've been doing, the federal government recognized our program and its worth and its value, and they said that every state in the United States had to have a program like ours. When we were created in 1986, there was only one other program, and in 1992, every state in the country had to have a program like ours, and we started receiving federal funding in addition to our state funding at that time. So we sort of became bigger and better and stronger in 1992 because of the double funding that we receive.
How many, and I have to say that the Shepherd Center of Charlotte is a Seniors Health Insurance Information Program counseling site.
Yes.
Along with the Senior Center on Tyvola.
Yes.
And so I know the answer to this question, but I want you to talk about it a little bit. This particular program is really volunteer driven.
It is.
And how many SHIP sites are there in the state of North Carolina?
That's a great question, Linda. Well, I tell people we have a toll-free number, and because we're a state agency, that toll-free number is based in Raleigh. And we have communications specialists that if you call that number, and would you like for me to give that out now?
Sure.
It's 1-800-443-9354. It's open Monday through Friday, 8 a.m. to 5 p.m. We have paid trained staff members that stock the phone lines, and we try to anticipate the number of calls we're going to get, whether it's a Monday morning. Monday mornings are usually busier than other days. Whether it's the day after a holiday or during Part D season, we try to stock our phone lines so that you don't have to hold for very long. Our whole time, we try to make that less than a minute. Sometimes, most of the times that works, but during Part D season, it's a little bit busier. Our members, our staff members are paid and they receive training, and our toll-free number is a nationwide toll-free number. And I know you guys border South Carolina, and there is a SHIP in South Carolina, but let's say you're a North Carolina resident and you go to South Carolina and you say, I need to call SHIP in North Carolina. You can do that, and it's a toll-free call. We have no automated response systems, so that means if you call our office, you don't have to press any numbers to get to anyone. You get a real-life human being. So that's what makes our program special. But anybody, any agency or organization can have a toll-free number. What makes our program special is that we've got volunteer counselors in every county of North Carolina that can sit down with you face-to-face at a convenient location, and any medical or financial information that you share is kept confidential. And we do that with these people called county counseling sites or coordinating sites, and it just so happens that in Mecklenburg, there's 2 of them. You mentioned the Shepherd Center where you're based, and then the Senior Center system in Mecklenburg County. And those coordinating sites act as a liaison between our SHIP office in Raleigh and the clients in every county that need to be served. So to answer your question, we have at least 1 coordinating site in every county, and in some of the larger counties like Mecklenburg or Forsyth, we may have a couple that share that responsibility to make sure that everyone in that community or in that county is served as they need to be. And we couldn't do what we do just by sitting in an office in Raleigh with a toll-free line. It takes our volunteers and our coordinating agency. So we thank you guys for that.
Let's talk about the volunteers for a second.
Okay.
Let's say that there's someone out there that would like to become a volunteer for SHIP. What do they do?
Well, I will use you guys as an example. Mecklenburg is a large county with lots of Medicare beneficiaries, and so we need a lot of hands. And over the past couple years, I've seen your program in this county grow. And it seems as if we do have people pretty much represented in all areas of the county, but we could always use more, and especially during Part D season. We were the first state in the country, the first SHIP, to have web-based training. And when I started with SHIP 15 years ago, one of my roles as the regional manager for the Piedmont area was to go out and do trainings, in each county. And we would have people that trained, and after they trained, they may or may not come back to be a volunteer. And so we said, we need to do something to keep in with the times, and so we have web-based training. And if a person is interested in being a SHIP volunteer, they would need to contact the coordinating site in their county, and we would set them up with a user ID and a password. And I tell people, you can take the SHIP training not by driving to a neighboring county or sitting in my classroom for 4 hours. You can do it in your pajamas, in your home, anytime, day or night. So we found that that's very, very efficient, and other SHIPs across the country have actually modeled what we do. And we find that if people take the web-based training, because they're more involved in it, they're more apt to volunteer once they've graduated. And it's a very rewarding experience to be a SHIP volunteer, because you can help a person save money, you can help a person find the right plan, and it's just a great thing to do. So we are always looking for volunteers in any county. And if you are interested in being a SHIP volunteer, you can call the SHIP office at 1-800-443-9354. Here in Mecklenburg County, you can contact the Senior Center for Tyvola or Tyvola Road, or any senior center in the county, or you can contact the Shepherd Center. And you can also visit our website, which is www.ncship.com. And down near the bottom on the left-hand side is a tab that says, "Are you interested in being a SHIP volunteer?"
Now, I have to say that I have taken the web-based training.
Yes, you have.
And it's open book.
Yes, it is.
And I wish I'd had that in college because I found it very easy. What I did is I would read through a chapter, and then I would take the training for that chapter.
Right.
And so I think there are like maybe 14 chapters, maybe something like that.
Yes.
And it's been a couple of years since I took the training, but and that really isn't all of the training, though. One of the things that we do at our site is we invite newly certified counselors to come in and shadow someone who is already a counselor. So we'll have someone from the community coming in, maybe they're turning 65, and they're getting counsel because they don't know what plan. Do I do Medicare? Do I do Advantage? What am I doing here?
Right.
And we can have the new counselor sit in and see how that is done.
So you're not just throwing a person into sink or swim, so to speak.
Right.
And that's what's really, really important with our program, because I won't lie to you. the SHIP volunteers that we have, it does take expertise and skill and training and knowledge and wanting to help someone. And so it's a little different than a lot of volunteer programs. We have a lot of SHIP volunteers that are also tax assistance volunteers because they like that knowledge level. And so it is something that once you've graduated, and as you were talking about the open book test, we want volunteers to know that once you've taken your training, when you're helping a client, you have a book as a resource that you can go back and look at, and that's very important. But once you've graduated, we all know that Medicare's motto is, once you learn it, we change it. So we want our volunteers to know once you've graduated, there are changes, many, many changes. And so we meet with our volunteers every quarter. Right now we're meeting at Southminster Retirement Community, and we meet every quarter to make sure that the volunteers have what they need so that they have accurate and updated information. It's like I remind persons, if you go to have your taxes filled out, don't you want to know that the person helping you has taken that year's current tax training? If they were last year's tax assistance people, they might not know of the new laws and so forth. So with SHIP, we want to make sure that people know about Medicare and that it's accurate, updated information. Otherwise, it's not going to be beneficial to you.
Right, and the other thing too is, if, for instance, we have a counselor who runs across a situation where they don't have an answer, they can always call the 800 number.
Yes. We have a special number for our volunteers, and actually that's a perk of being a SHIP volunteer. In addition to the consumer toll-free line, we have a line just for SHIP volunteers and coordinators. They can call that number, and there's a few people that answer that number, that line, and we can give them answers. And also, if you're a SHIP volunteer, you have a special number to call for Medicare, and you have a unique ID number, so you can sort of go in the back door, so to speak, or through an underground tunnel to get what you need and not have to wait and speak to certain people. So there are some perks with being a SHIP volunteer. And when our program first started 25 years ago, Linda, people took SHIP training to learn about Medicare for themselves because they were going on Medicare. And while that's helpful, because it's a peer counseling organization, but now we have people that are younger, maybe they want to just volunteer, and so they take the SHIP training, and then when they go on Medicare, it's much easier because they've already helped many, many people. So.
Right. Now, like you said, with Medicare, things change.
Yes.
Constantly.
Yes.
And we've got some changes coming up for the year 2011. And can you talk, and one of the basic things is the open enrollment period. Can you tell me a little bit about that?
I sure can. You know, you hear a lot of people talk about health care reform or the Affordable Care Act, and it's very lengthy. It's 20-some, 100 pages. And a lot of, when the law was passed, people were unsure about it because they felt like that the whole law hadn't been read or interpreted. So they were very upset about that, or had some doubts. But what we remind people on Medicare about with the health care reform is there were some really good changes that came into being this year and in years following because of health care reform. One of those being that they've moved the Medicare Part D or Medicare Advantage enrollment period back a month, and they're going to actually cut it off a little earlier. From 2006, when Part D started, till 2010 or 2011 enrollment, the enrollment period was November 15th through December 31st. So you and the volunteers know that you had to, help people throughout the end of the year. You're trying to close down a month, you're trying to close down a year. There's a couple holidays involved there. Our SHIP volunteers wanted to celebrate holidays, but they felt an urgency to help as many people as possible. And so what they've actually done, Congress is who controls Medicare, they've decided to push it back so that Part D and Medicare Advantage enrollment for 2012 and years beyond begins October 15th. And it actually cuts off December 7th. So we get the end of the year back, we get the Christmas holiday back, but the good thing for consumers is, if you could have enrolled in a plan till December 31st, the plan started the next day. Well, you weren't in the system and you didn't have your card. So that made things a little bit frustrating for some people. So now they're gonna have from December 7th till the end of the year to get people in the system and to get their cards to them. So really, it's much better this way. And so we're really excited about that new enrollment period. And what we want to remind people of, Linda, is if you've got a Medicare drug plan now, or you've got a Medicare Advantage plan now for 2011, October 15th through December 7th is your time to evaluate your plan for 2012. You might be in a plan now that's best for you now, but the plans change from year to year, and you will get a letter about that. And your prescription needs may change throughout the year, and you normally can't just up and change plans in the middle of the year, so you have a specific time. And so we want, even though it creates extra work for us, we want to help as many people as possible compare plans, search for the right plan, and enroll in the right plan for 2012. And we're all about teaching people how to fish instead of dumping a fish in their lap. So if you call our office and say, I've got computer skills, we might tell you how to go to the Medicare website and walk you through that so that you can not only help yourself, but you can help other people.
Right, and one of the things too is we really encourage everyone, all right, so you have a plan. And you may come in and sit with a counselor and find out that it's still the right plan for you.
Right.
But you want to check that out because you don't want it to be January 1st, 2012 and find out and all of a sudden get a bill in from a supplemental or something and find out that, oh my gosh, I'm in the wrong prescription
and
plan.
It's too late.
Or when you go to the pharmacy and you find out that things that cost you maybe $8 before or were free are now costing an exorbitant amount of money.
Exactly. I went to another county a couple of years ago, and of course Medicare Part D started in 2006. So I was doing some counseling, and out of 7 people in that county, 5 people had the same plan that they'd had since 2006. And when we did searches and comparisons, every single one of those people had better options. And when we helped them enroll in a new plan, not only did they have a better plan for the next year, they saved some money. And that's our goal at SHIP, is to help a person find the right health insurance product for the least amount of money, because we realize whether you're 65 and older or you're on Medicare due to a disability, more than likely you're not working and your income is limited and it's fixed. And so it's very, very important that you make the best use of that money. So it's rewarding when we can help a person find the best plan for the least amount of money and to save money.
Okay, let's just say but let's just say I'm turning 65, okay? It'll be in a few years, but anyway, I'm turning 65 and I come in and get counseled, and I really don't want to sign up for a prescription Part D plan because I don't take any medication right now. That's a bad thing to do, isn't it?
It is, and I have these analogies, Linda. I would say to a person, do you have automobile insurance? And hopefully they would answer yes, and I would say, do you get in accidents? Do you ever think you're going to get in an accident? And they would say no. But you have automobile insurance, right? Yes, just in case. And so the point I'm trying to make to that person is, you might not be taking any prescription medications at that time, but Murphy's Law is, as soon as you don't take it out, January 1st gets here, your enrollment's over, and your doctor's going to write your prescription, and you have no plan for that year. And also there's going to be a penalty when you can enroll for next year's plan. So even if you take no medications, there is a plan that's less expensive, normally $14, $17, and it's worth that investment every month just to have a plan in case you need one. And then if you don't need one, then you won't have a penalty when you actually do need that plan. So again, it creates extra work for us, but we would tell that person, you do need a plan even if you're not taking any medications.
And the penalty is forever, right?
It is forever, yes.
It's a yearly penalty forever.
Yes, and that amount usually increases a little bit every year. So you might say, well, this year it's not so bad, but in 10 years, the price may add up. So we just tell a person, insurance only works, regardless of what kind of insurance it is. Insurance only works if you pay into it when you don't need it, hoping you don't need it, but if you do, it's there for you.
Okay, do you have any idea of any of the changes that might be coming up for 2012?
Well, there's some extensions. The Medicare donut hole for Part D, you hear a lot of people complain about that. The donut hole is not a good thing in this situation. But in the year 2011, Medicare Part D's donut hole started shrinking so that there's a discount for both generic and brand name drugs. And then from 2011 to 2020, under healthcare reform, that donut hole is going to shrink and shrink and shrink. And by the year 2020, it's going to be gone away altogether, which is a good thing. Some preventive benefits have been added. There's now no longer a deductible and co-pay for preventive benefits, again, under healthcare reform. Medicare Advantage plans, there's some changes with that under healthcare reform that started in 2011, and they'll gradually be phased in. Medicare and You is the handbook that goes out in the fall of every year, and it might be pushed back a little bit this year because of the change in the enrollment period. But I remind people that are on Medicare, you paid into Medicare Part A when you were working or your spouse was working, and when you go on Part B, more than likely you're paying a premium for that. You're a consumer, and the way that you know how Medicare works best is to read that Medicare and You handbook. That is your owner's manual. So you need to read that, and they will always indicate in that Medicare and You handbook what the changes are for that year. So it's very, very important that people are educated and informed when it comes to Medicare. We especially want to make sure that we're reaching out to those people with limited income and resources. And you all know that every person that comes into our office or in your office, we screen not to be nosy or to ask personal sensitive questions, but to find out if there is any program that they might qualify for, because we want them to get the best assistance that they can get, and all the programs that they are eligible for, we want them to get those as well.
All right, so that was going to be my next question. What about people who are, having low-income subsidy?
Yes.
Is there something, an avenue for them?
Well, the income amounts usually change January 1st of every year, or April the 1st of every year. The resource amounts usually change January 1st. Sometimes it happens, sometimes it doesn't, but that's normally what happens. So you may have a person that says, well, I applied for extra help for Part D, or I applied for some level of Medicaid and I didn't get it. But remember, your situation could change throughout the year, and those amounts change every year. So we would encourage a person, if you're having a problem paying for your prescription drug benefit, if you're having a problem paying for the medications that are prescribed for you, then call SHIP or visit a SHIP coordinating site by appointment and let us screen you on a regular basis to see if you might qualify for any of those programs. And a lot of times there's a stigma associated with that. People don't want a handout, or they don't want charity, or whatever you want to call it. But what I remind people of is, let's say this restaurant is giving out something to everybody whose birthdays are June the 8th, okay? Well, that's not a handout. You're eligible for that free meal because today's your birthday. And that's how we like to look at it. It's not a handout, but you're qualifying for a program because you're eligible for it. You meet the requirements. And so we try to help people see that, because we would rather you receive that assistance and get the medicines that you need versus the alternative, which may not always be good.
Now, is yearly screening enough for that, or do things change more frequently?
Normally, yearly screening is good unless your status changes, unless your income decreases or your resources decrease. Then at that time, yes, you need to contact us or contact the Department of Social Services or Social Security. There's 3 agencies that can actually help a person with that extra help application. And just to clarify, extra help is also called low income subsidy, and it's a part of the Medicare Part D law that started in 2006 because the government realized that there were people with limited income and resources who may not be able to afford their prescription drug benefit, or that they could afford it but then they couldn't afford to pay their copays or their deductibles. So there are income and resource requirements, and if people qualify for those things, then they might not have to pay a premium for their Part D plan. They would have no deductible. They don't have the donut hole. They have consistent copays that are affordable from January 1 to December 31st. And so if your status changes income or resource wise, call SHIP, call Social Security, call the Department of Social Services, and we can help you decide, what's going to be best for you.
Well, with the economy the way it's been lately and everything, are we finding that there are more people that are now qualifying for that?
Yes.
Simply because maybe they had a nest egg that is gone, or something like that?
Exactly, yes. We are. Our volunteers are expressing to us that when people come in, they are finding that because of the economy, their status or their situation has changed. And maybe last year they applied and they were just over, and now they are qualifying because their status has changed.
Mm-hmm. Okay, again, if someone wants to so there's a couple things. If you are turning 65, mm-hmm. and it doesn't matter what time of the year, now there's a window, isn't it? What is the window for that they should come in and get counseling?
That's a great question, Linda. I always ask a person that's turning 65 or they're going on Medicare due to a disability, are you already receiving a Social Security check? And we work very closely with Social Security in all parts of the state. If a person's receiving a Social Security check prior to being eligible for Medicare, they do not need to apply for Medicare, or they don't need to enroll. They're automatically enrolled. They will get their card in the mail about 3 months before they turn 65 or before they go on Medicare due to a disability. If they're not automatically enrolled and they are getting ready to go on Medicare at age 65, they do need to contact Social Security, or they need to go on the socialsecurity.gov website to see what they need to do. We normally suggest that a person come to see us about 3 or 4 months before they turn 65. We have a really good handout that's on the SHIP website. It's called the Road to Medicare. It's under the Publications tab or Enrolling in Medicare tab. It's a 4-page document, and I compare it to a wedding planner in that it tells you what to do. Everybody chuckles when you say wedding planner for someone turning 65, but it tells you what to do, when to do it, the order in which to do things, and of course it talks about those deadlines. And nothing is more sad than doing a presentation to a group of people and someone coming up to you afterwards and saying, I wish I would have known about you before I turned 65. I didn't know where to go. I didn't know whom to call, and I don't know that I made the best decisions on my own, and now it's too late. So we want SHIP to be a household name before people need us. So it's very important as you get ready to turn 65 or to go on Medicare with a disability to call SHIP about 3 or 4 months in advance at least, so that we can help you start down that journey. We want it to be a pleasant experience. We don't want it to be frustrating or something that you worry about. Let us help you and take that guesswork out of going on Medicare.
Now, if you're automatically enrolled in Medicare, say because you're already collecting Social Security,
Right.
What about Part D?
You still need to sign up for Part D plan in most cases unless you've got Medicaid of any level or you qualify for extra help. Even if the government puts you in a Medicare Part D drug plan, they go eeny, meeny, miny, mo. There's no thought process. There's no selection. They just put you in one so you have one. That's not the best way to do it. We want to help you find the right plan. So yes, you would need to enroll in the correct Medicare Part D plan. You may need a supplement. You might decide you need a Medicare Advantage plan. You might have a retirement medical and drug benefit that you can keep that's better than Medicare Supplement, Medicare Part D. We can help you with all those things, no matter what your situation is. And our services are free.
Okay, once again, give us the 800 number.
The 800 number is 1-800-443-9354. It's a nationwide toll-free call, open Monday through Friday, 8 a.m. to 5 p.m. And we've got paid trained staff members that answer any question with no automated response system. And our website is www.ncship.com, open 24 hours a day, 7 days a week.
Well, thank you, Jeannie. It's been very informative, even for me, and I should know this stuff because I'm a trained counselor. But I want to tell everybody that, of course, you can call our office, 704-365-1995, if you want to set up a Medicare counseling appointment. And we do that, during the week, any week, all through the year, except maybe the last week in December. It's kind of hard to find a counselor to come in for that. And don't forget about our Adventures in Learning program. That is going on every quarter. So until next time, thank you for joining us, and we look forward to seeing you next month.